Taking care of your memory as you get older. We're going to talk about that with Dr. James Ellison from the Swank Foundation, Endowed Chair in Memory Care and Geriatrics at Christiana Health System. You are a geriatric psychiatrist.
That's correct.
And I understand that's a rarity.
Well, there are several geriatric psychiatrists in Delaware, but around the country there's fewer than 2,000 board-certified geriatric psychiatrists, so it is a special form of psychiatry.
Why is it? Well, I was just told by someone with the hospital that there are fewer geriatric psychiatrists than, for instance, child psychiatrists.
It's true that there are fewer geriatric psychiatrists per elderly person than there are child psychiatrists per child in this country.
Is there not a demand? There's
a huge demand, and there's a growing population of geriatric psychiatrists to deal with the increasing older population of people.
And you also, we also talked about the memory studies and,
yes.
and the memory care. What does that entail?
Well, I work with the Swank Memory Care Center, which is part of Christiana Health System, and it's the only outpatient memory care program in the state. And what we do there is we evaluate older adults with memory problems or other kinds of cognitive problems. It could be personality changes or loss of interest. Sometimes it's caused by depression, sometimes it's caused by medical illness, sometimes it's caused by medications that people are taking, and sometimes it's Alzheimer's disease, which is the most common cause of memory loss in the elderly.
And is that why it's important for you to start studying memory loss when it happens, so you can study to see exactly where this is going?
There are lots of studies now that are looking at the earliest signs of memory loss. For example, we know that memory starts to change in your 20s and in your 30s. By your 30s, you may be starting to have a little trouble recalling unfamiliar names. And by the time you're in your 60s or 70s, many people worry about their memory not being as sharp as it had been.
But from what you're saying, that's normal though, right?
But that can be normal. And the kind of normal changes that occur as we get older, and this happens for most of us, is a little bit of slowing down, what they call decreased processing speed, some greater slowness in processing new information and learning new things. You must have to learn 1,000,000 new things for every show, so you probably notice that it takes a little bit longer. You have to rehearse things, remind yourself, right? And also inhibiting response is something that changes as you get older, so that you might be more likely to make a quick decision or a quick choice. But on the other hand, as we get older, our vocabulary increases, our store of information increases, and our wisdom, our ability to use what we've learned in the past to solve problems is something that increases too.
Oh, there is an important distinction then, and you'll tell me how you know if memory loss is leading to something more serious or memory loss is normal. So when you're meeting someone and studying their memory or talking to them about their memory, how do you know warning signs?
Well, the memory is more than one mental function. For example, when you remember how to ride a bicycle, which you learned when you were a child, that's called procedural memory. When you remember what happened to you yesterday, that's what's called episodic memory. And the recall of short-term episodic memory, things that have happened recently to you, is very sensitive to disease in certain parts of the brain. So we check for that. We check using tests that look at things like the ability to learn a list of random words, or to learn and remember the details of a story. And some of these tests have been refined to the point where we have norms. We can look at a general population and say, this is what a person would be expected to forget. And if we see somebody go beyond those norms for another person who's normal of their age and educational background, then we can say, well, this is suspicious. Then we also look at their health record, and we look at an imaging study of their brain. We can do more detailed neuropsychological assessment and a physical examination. And putting all those things together, we're about 90% accurate in determining whether something is a disease. There are also some new neuroimaging techniques that look, for example, at the accumulation of abnormal protein in the brain, what's called beta amyloid. And some of these new techniques can determine the presence of early Alzheimer's even before clinical symptoms are very apparent.
Is there anything you can do for your brain health early that can prevent you from having problems later in life?
There are tons of things that people can do, and they're all what I would call very low-hanging fruit. They're easy things to do. So for example, if you have high blood pressure, it's important to get it treated because high blood pressure in middle age is predictive of cognitive decline in Alzheimer's in old age. Diabetes should always be managed very carefully and appropriately because diabetes and hypercholesterolemia, high blood lipids, also predict development of dementia in later age. Smoking, which still some 35% of older adults do, is another predictor of dementia in later age, vascular dementia as well as Alzheimer's. So these are some important diseases that a person can take care of. Now there are other things too.
I was going to ask you about one other thing though, quickly. Is there any evidence that dementia or Alzheimer's is hereditary?
There is some evidence for a small number of cases, what they call early onset Alzheimer's disease. Now some of those cases are sporadic or accidental mutations, but there are families in which Alzheimer's disease is very heavily inherited. It's an autosomal dominant inheritance, which means half of the children of an affected adult will have the gene for this disease, and most of them will develop it before 60. But that's a rarity among Alzheimer's disease. Now, there's some heritability for the later type of Alzheimer's as well, but it's much less. But let's get back to what you can do about your memory, because there's some very important things. Physical activity is one of the best proven ways of increasing your health as you get older. The brain is situated in the body. It's not just an isolated brain sitting on a plate somewhere. So if you take care of your body with physical activity, that's very good for your brain, and it also helps these other disease conditions like high blood pressure, blood fats, diabetes. So that's an important thing.
Any truth to doing mental activities like crosswords and board games and reading? Does that help as well?
Many of my patients ask me, should I do crossword puzzles? And I say it would be great to do a crossword puzzle, but why don't you wait until after you take a walk? Because I think physical activity has more evidence supporting its value. There are brain games. Some of them are things like crossword puzzles or Sudoku or Ken-Ken, and those can be diverting and fun. Board games are great because they involve you with other people. So Scrabble, for example, is a social game. It combines a couple of things that are important: social engagement, competition, fun, as well as mental stimulation. Then there's some computerized brain games as well that are out there that you can either get over the internet or for your own computer.
Wonderful. Thank you so much. We got more than I expected. I really appreciate that. It was fascinating. Please come back.
Pleasure to talk with you.
Love to talk to you again. Dr. James Ellison, Swank Foundation Endowed Chair in Memory Care and Geriatrics, Christiana Care Health System. Thanks again for being here. I'm Larry Menti. That wraps up the Delaware Way. Stick around for another thing.